Can you tell me where you're watching or participating from? Show me one person waiting. Are we live? I'm not showing, it's not showing on YouTube that I'm live. Okay, I can see it now. This is YouTube. So I like to know where you are watching from. So please, you can drop your question. So I have the first question here from Instagram. I like to know those that are already seeing me from Instagram. So the first has is hello, Dr. Rita. This was sent to my inbox incidentally. So the first question I have here is what are some of the common causes of kidney problems? Incidentally, I'm very amazed that that is the question that is the first question that came to me. Of course, not all questions, I may not be able to take all questions on this platform, but as much as possible, I would I would try as much as possible to answer you as much as I can. But I like to be sure that I'm being heard. Please drop a comment in any of the platforms. I need to be sure that we're live on Instagram. It's very important to me. Thank you very much. So, my first question is common cause of kidney common cause of kidney problems. Okay, so um there are quite a number of kidney problems, but the most common ones that causes it for a lot of people that they are not aware of is excessive use of painkillers of your kidneys and the test to go and do for of your kidneys and the test to go and do for kidney related problem. And she decided to go and check her kidneys and she was surprised. She's not hypertensive, she's not diabetic, she's in her late early 50s, late 40, early maybe like 51, 52, I think. So she went to go and do her. She just went, she said she usually experienced back pain. She didn't even know that the back pain was associated with, and so I'm going to run through the symptoms of kidney problem shortly. But she was talking about it being associated with with so she didn't know that the back pain was associated with kidney problem, and so she just went to do some tests only for the test to show that her EGFR was showing that she was already at stage 4 kidney problem. She was surprised, she could not believe it. She didn't have any symptoms, her legs are not swollen, just the occasional back pain, and sometimes her urine is a bit foamy, but that's just about all it is. So yes, I sent out a polling vote for your creatinine, and then also you should do your EGFR. That's a very important test. It usually helps to check the stage your kidney is. Your kidney at tops must always be of your kidney function. Like, that test usually used to check the grading of the kidney and the kidney function. So it's always good that you check you check it, and then if you've done it, you can reach out to us. There are some numbers that are going to be scrolling on the screen for you to book to do a consult. More male hormone, more androgen, more male hormone than female hormone. So because her body she has more male hormone, she will not be ovulating. So how would you know? Sometimes there may be some symptoms that the woman may experience, which will be that she will be having infertility. At other points, the woman may be experiencing conditions like facial hairs, a lot of facial hairs. She may even be having hair, a lot of, apart from facial hair all over her body. She may have a physique of like a man, but she's not really a man. But those are because of hormonal imbalance. So but the main thing that usually causes a woman not to ovulate really really is most of the time as a result of hormonal imbalance. And hormonal imbalance is also a common factor in cases of polycystic ovarian syndrome, where there is also imbalance in the hormonal level, imbalance in estrogen. So hormonal imbalance is something. And how will a woman know and do a hormonal profile? So when you do a hormonal profile, so and sometimes what are the symptoms that somebody has hormonal imbalance? Somebody may have an hormonal imbalance, and it may not only be affecting her ovulation. She may be experiencing irregular menses. She may be experiencing cystic. Um, she will have acne, cystic acne in her face, very large lumps on her face. She may also be having heat, internal heat. She may experience pain, pelvic pains. So these are some of the things. And I want to say to you that infections do not cause hormonal imbalance. Please ask a question that I have here. Does infection cause hormonal imbalance? No, infection does not cause hormonal imbalance. So please, I'd like to know, where are you chatting from? Where are you watching from? Please drop your comments. And then I want to know, if you are in the groups, please drop your comments in the comment section. If you are watching from Instagram, please let me know. Are we live on Instagram? Okay, so I like to have comments that are coming in from Instagram, so that I can also take them. Please send all questions to me personally as I'm live here. So remember, this is a 30-minute session. So next question that I have is a question that I've addressed before, but because this person is, thank you. Okay, I am vision designer, is watching from Lagos. Okay. So Lagos is helping the charts today. Mr. Frederick Thomas is watching from Lagos. Thank you for logging in. So I need to know where every other person is watching from at the moment. Please drop your comments for me to know where you are watching from. So I was asking, the next question that I have here, some of the questions I was not able to finish writing them before I came live. So some of the questions I have here is a lady that sent it to me. She said, "Hello, Dr. Rita. I have, I have," she said, "I have been diagnosed of infection. I've been diagnosed of infection. I've been treating infection frequently, and but my husband, every time he does his test, does not show that he has infection. How?" And then he's getting concerned and worried that I'm always treating infection. Please, can you explain why? Okay, so I've really treated a lot of things on infection. But let me just say this. There are different types of infection. Not all infections are sexually transmitted. So it is possible that the infection that you are having is not, your husband is not able to contract it. For instance, an infection like vaginal bacterial vaginosis, condition in which the normal flora, the normal bacteria around the vaginal region, they overgrow. And so because they overgrow, you now find out that um, it now makes them to have symptoms like itching, discharge, discomfort, and all that. And they can have a sexual relationship with their partner and not have any type of transfer of that infection to their partner. Also, a lady can have an infection like candidiasis. Candidiasis is a fungal infection. Sorry, the husband may not pick it up, unless if the husband is doing oral sex. You may pick it up from that, but it's not this and so then you want to find out. So if you say you're always being infected with bacteria, with infection, you're always being diagnosed of infection. So it's possible that you are reinfecting yourself. It's also possible that the problem is that you are not completing your circle, or your treatment circle. That could be one. Number two could be that you are reinfecting yourself. So what should you do to prevent reinfecting yourself? Ensure that during your period of your treatment for antibiotics, I always say that one of the ways to break bacterial circle is to ensure that your underwears, your undergarments, and everything, that you treat them properly. Well, how do you treat your undergarments? You wash them with soap, and then you spread them under the sun. And then when you do that, also another thing, your bed linens, your bed sheets, your towels. So in the course of treatment for any type of infection that you have, ensure that you now, as you are taking drugs to prevent, to stop the bacterial activities, you are also disinfecting your house, your bed sheets, your towels, all the, all those things. If it's possible, depending on the type of bacteria that you've been diagnosed to have been infected with, you want to ensure that you go ahead and, you know disinfect, wash, spread under the sun. Then one key thing that I need to say to you, if you're always having recurrent infection, is to avoid spreading your undies in your toilet. Yes, avoid spreading your undies in your toilet. A lot of studies have been done in toilets, and it has been shown that especially when you flush with your toilet lids open up, bacteria from fecal activities can settle on the pants, you see. And a lot of people go and do tests, they do swab, and they find E. coli. E. coli is something that is really abundant on fecal matter, but you can find it in the semen, in the fluids of the vagina. You can find it also in the fluid in the semen. Why? Sometimes this bacteria can come in from fecal activity. Another thing again that you need to do in preventing infection, if you're always having recurrent infection, is to ensure that you do proper hygiene. And how do you do proper hygiene? A lot of studies have shown to you that as a woman, do not doge. When you doge, you strip yourself of the natural flora, you strip yourself of the pH, which can make you prone to infection. Also, when you are to clean from front to back. So in wiping, you wipe like this. You don't wipe like this and like this. You wipe from front to back. It is also been said that it is better you use a wet wipe, or you use water. And then when you use water, if I use water and soap to wash, it's always best to use water and soap to wash. During the COVID period, we saw the effect of using soap to wash your hands. And then last thing, for people who keep very long fingernails, it is important that you know that you can infect yourself from your fingernails. Bacteria that are stored in your fingernails, they can get there. So I hope I've answered you. And then if you have been treating yourself for bacteria and it's not going, it's possible that you have also had this, you also have developed a condition known as resistant bacteria. Happens resistant bacteria happens when resistance to bacteria, sorry, to antibiotics happens when you have not, when your body, you have been exposed to a lot of antibiotics, and then the microorganisms themselves, they have now formed a resistance. And in fact, there was a study that was shown that even a newborn baby that has just been born, I think this was, I think 2 months ago, or last month or 2 months ago, it was said that a baby that had just been born, it was being found that because of the frequent use of antibiotics by the parents, by the woman, over the period of time, the child was already resistant to a lot of the antibiotics. The child that had just been born, when they took blood sample to run test, was resistant to almost all antibiotics. So what you do in those cases, that is why you need my product. My products are there for you. My Reese antibiotics, they have been formulated together, put together, about 16 herbs put together to help your body. Not only is it going to destroy the abnormal bacteria, it is going to help the normal healthy flora. Every part of your body has bacterial activities that help to keep it. The problem is that one bacteria from one place crosses to another place and goes to cause problem. But when you use my antibiotics, what does it do for you? It helps to keep each one within their own gate. How does it do that? It increases the sensitivity of your cells of your body to their job, and then they are more active, they are more prone, they are more alive, and they are able to do it. So I hope that I've been able to answer your questions. I'm waiting for questions from people who are participating right now online. So you can drop your question in the comment section. You can drop your question. Okay, so there's a question here. Okay, from Facebook. Okay, I have a question from Facebook. Thank you so much. I would like to know the names of the people so that I can recognize them and where they are. So we are logged in right now on Instagram, on Facebook, and on YouTube. So I'm not seeing everybody because it's on the central, but thank you so much for logging in. I'd like to know who. From Vera Godwin. Wow, thank you, Madam Vera Godwin. Okay, can infection prevent someone from conception? Yes, infection can prevent someone from conceiving, from conception. Yes, infection can. In fact, in case of PID is a pelvic inflammatory disease. This is a condition where an infection has spread from just the point of entry in the vagina. It has spread up to the through the from the vagina to the cervix, from the cervix uterus, from the uterus it goes to the fallopian tubes, from the fallopian tubes it can even go to the ovaries. Now, how does this infection work? This infection, when they produce a lot of fluid, slimy fluid, and then this fluid, they mask the walls and they cause a lot of inflammation. Now, this can affect ovulation, this can affect the tubes and make the tubes not patent, this can affect implantation of pregnancy, and sometimes the person doesn't even know that they are experiencing this thing. It doesn't even show any sign for them at all, at all, at all. Sometimes also the pain may be the pelvic inflammatory disease, which is when infection. So when the infection has spread so far away, these things can happen. It can cause back pain, waist pain, shoulder pain, pain that radiates from the waist to the feet. It can cause internal heat. It's very discomforting, and it can be an infection can be in the pelvic region for up to 20 years. And so yes, infection can, in fact, there are lots of um, there are lots of different types of infection that has been isolated to cause bacterial infection. So I like to hear more questions from people watching. I'm waiting for more questions because it's supposed to be a live question and answer session. So still waiting for you, still waiting for the team to send me more information. But if you look on this Instagram, sorry, on this YouTube, if you're on YouTube, please go to Ask Dr. Rita Show. I've done a video on pelvic inflammatory disease, and I've done a lot of videos on bacteria. In fact, this month of September, I've been reviewing a lot of cases, plants, and conditions that have to do with infection. So yes, and then if you have been diagnosed, how do you know that you have pelvic inflammatory disease? Aside from doing a swab, high vaginal swab, something else that you can also do is a pelvic scan. But I always advise people to do um, abdominal pelvic scan. So we're not just checking your pelvic region. So you can do an abdominal pelvic scan, or you can do only a pelvic scan. Pelvic scan is that scan that people do to check for pregnancy. So yes, infection can cause infertility. Yes, infection can cause infertility. Yes, it does. So waiting for more questions. More questions, please. Waiting for more questions. So, question. I have a question here on cancer that has been sent to me. So, the thing with cancer is that it is a very broad condition that takes that. In fact, if I think I've done videos on cancer, but it is a condition that requires in fact, the whole of the 30 minutes or even 1 hour is not enough to deal with cancer. But let me just answer this person, because this person is someone that I know, and the person was asking me, why do people have cancer? So cancer is an abnormal cell formation in the body. That's simply what it is, abnormal cell formation. So any cell that abnormally, that I usually want to explain it in literal terms, to say when cells now leave alignment and now go and form their own, they begin to manifest all about that. So abnormal cell formation. Now there are different factors that can cause it. A lot of different factors. It could be hereditary. It could be as a result of lifestyle. It could be as a result of lifestyle. It could be as a result impact of certain drugs. It could be as a result of so depending on the type of cancer, it could also be as a result of some procedures that people have done, and as a result of those procedures, they were exposed to some kind of drugs that are carcinogenic. So it depends on it. It also depends on exposure to poisonous substance, like some kind of what some we call them arsenic properties. If you are close to a place where the water has some poisoning, some metallic poisoning that can affect some cosmetic products, have carcinogenic chemicals in it. All these things are things. Some of the foods that we eat, some of these GMO, they have been genetically altered. You remember that cancer is basically an abnormality. So anything that causes an alteration in the cells of the body would, would, would cause someone to have a cancer. Now there are different types of cancer. We have the benign cancer, we have the malignant cancer. Benign cancer means that a tumor that grows abnormally but is in within its own area. It has not moved to another place. Then you have the malignant one, the one that grows from one area and then it begins to spread through the lymphatic system, spread around the body. So you see, there are different types, and then there are different stages of cancer. So when not so that when you say cancer treatment for cancer, the stage matters, the type matters, the cause matters, the incidence matters. So but what are some of the signs? And sometimes, to be honest with you, some type of cancers, you may even be living very healthy, you may be having a perfect life, and yet you do not know how these things come up. Those are called idiopathic. There are some cancers that science cannot even explain how they came about. So what are the best treatments? What is the best treatment approach? I would say, because the type, the stage, the health status of the person, the health status of the person in question also plays a very important key. So for cancer is not a case where I just say, oh, go and do this, go and do this, go and do that. Even if you're asking me what test can you do, like I said, there is cancers are named according to the body parts. So I cannot just say go and run this test, go and run this test. But then there are some tests that you can run, CA125, tumor marker test. These are tests that PSA for a man does PSA test, prostate specific antigen. That is a test for a man that can use to that a PSA is high does not mean that somebody is already carcinogenic, so that the man has cancer, because there are several things also that can cause PSA to be high that is not cancer. So you see that a consultation, a one-on-one consultation, a personal relationship with your doctor, knowing your history, will now determine what test to do. Because what are we testing for? Are we testing for cancer of the blood? Are we testing for cancer of the skin? Are we testing for the cancer of the liver? Are we testing? All these tests require a different testing approach. They require a different treatment approach. Sometimes some people come to me, and when I look at their test result, for me, consulting with a person, I must see your test result. Without test result, I may not be able to give you. I always say I don't do magic. I'm not a magician. I cannot do magic for you. Okay, so I'm seeing question here. All right, so let me finish talking about the cancer. So anyway, so a consultation is very important. Now, please, doctor, can infection cause miscarriage to a pregnant woman? Okay, so it depends on the severity of the infection. It can cause and it cannot cause. You see, it can cause and it cannot cause. The reason being that it depends on the health of the woman, it depends on the stage of the pregnancy, it depends on the type of infection. A systemic blood infection where the whole blood is infected may affect, may affect the pregnancy and cause the woman to have a miscarriage. But it's not in all the cases. Not everybody have that level of infection in their body. So yes and no. But unless there's another factor, unless there's another thing again, just the infection may not be enough to cause that. So a proper history of the person. So sometimes, now let me give you a scenario of what I mean, yes and no. So there was this woman that came to me. She's done. She's married. She she was pregnant, and she had a missed product of so anyway, not missed product of conception. She had a miscarriage. What I mean by miscarriage in this sense was that the baby died in her womb. So they had to remove, they had to she had an evacuation done. Now, when they did that evacuation, there were some fragments from that dead baby that were left in the uterus. Some fragments. You cannot imagine how much they spent. The woman was not well. Every time she got pregnant, something was always happening to that pregnancy. The pregnancy would drop off. You know, it took a lot of. So by the time she came to meet me, we did we did some. So I took her history, and then I sent her to do a test. She did an MRI, you know, of the pelvic region, and it showed us, you know, the MRI was able to show us that there were some abnormal tissues. You know, the result gave us, it gave us, and then she did swab. She did a lot of tests, and then we had to embark on treatment. Now, in the course of the treatment, she had to start draining. She drained a whole lot, and we are not even, the treatment was supposed to run through a period of like 2 months or thereabout, but by no about 3 months. But by the second into the third month, she took in, and today, Mrs. Sarah has a twin, Sarah Reason, you know. So that is a case that I can give to you. So it depends on what caused it. It depends on a lot of factors. So yes, it can cause, and no, it cannot. So I hope I've answered your question. So I have a question here. What do you do when your ESR is very high? ESR is a test to show inflammation. In fact, this is one of the tests that shows that there's an inflammatory activity with your, you know, it's a test that generally shows that there's inflammatory activity. Usually your immune system is active, something is affecting your immune system, you know. So when your ESR is high, sometimes you may not be able to by yourself isolate what is the trigger for the ESR. You require a consultation, you require a professional to help you to be able to, you know, isolate what. So because when we say ESR is a test that shows that there's inflammation, inflammation is taking place. Okay, how high is this level of inflammation? You need to know. Then the way you are looking at this level of inflammation, you want to now compare the level of inflammation with your white blood cell activity. Is there a correlation? You want to check the level of this ESR with your bone. Is there a problem with the bone? You want to check it with the liver, with the organ. So it's something that require assistance to be able to find where is inflammation is taking place, what is triggering this inflammation, what you need to do about this inflammation. It's very important that you are able to do that. But then also, you want to now compare your ESR with your uric acid. Usually, when your uric acid, when your ESR is high, your uric acid sometimes also may be high, and that may be an indication that you are having gout. You know, so if you're having gout, another, so one thing you want to do is you want to now be sure that, okay, your diet, you want to ensure that you are eating healthy diet, you want to ensure that you're taking a lot of fluid, you want to find out, are you going through some period of plenty of stress, you know, are you on certain medications? There are some medications that have the possibility to trigger high level of ESR. So what should you do? If you can sit down to do personal assessment, to do all this, you can do it and be able to isolate where it is. Or, so I'm looking at question, or you want to also or you can isolate it, or you want to reach out to me to do a consultation session with me, and then we can help you isolate it and then help you find out where is this thing starting from and what is it affecting right now, what is the symptom that the person is experiencing. Because for you to already say, it means that the person is experiencing some symptoms that led them to go and do some tests, and then by the time they do the test, and then is the person trying to conceive. So, oh, is the person a man? Is he having prostate? You see, so There are lots of things, but ESR is generally a test that shows the level of inflammation in the body. Usually when the immune system is hyperactive, it will show you from the level of ESR. I hope I've been able to answer your question to the best of my ability. Doctor, can infection cause an infection to, trying to understand this question? It's not coming up very well on my side. Doctor, can infection cause a breastfeeding mother not to have, okay, doctor, can infection cause a breastfeeding mother not to have breast milk to feed her new baby? Okay, so when a woman has infection, now what kind of infection are we talking about? Are you saying general infection or breast infection? So I'm not aware, but well, no. There are other factors that can cause a woman not to breastfeed, not to produce milk. It could be as a result of hormonal imbalance. It could be as a result of diet. It could be as a result of stress. And then it could be that, usually when a woman just give birth, well, just gives birth, the first 20, the first 1 or 2 weeks, it could mean that the woman's body is still getting ready or still preparing. Some people, so the woman is not yet producing enough milk. But the thing that stimulates breast milk is the child sucking the breast. That reflex of the child sucking is what sends a signal to the brain that now returns a signal back and causes the woman to produce milk. You see, so if a woman is not breastfeeding regularly or properly, it may affect. But that infection caused it, no, or unless there is a blockage in the ducts, that in itself is another condition in itself. So a general infection may not affect, but an infection around the breast or a problem with the breast, if a woman has a problem, and it depends on the infection, please. The infection may not affect the production of breast milk, but the infection can be able to can be able to affect the child through the breast milk. So when a woman is having some kind of infection, for instance, a woman that has hepatitis may not be encouraged to breastfeed her child because of the hepatitis, so that she doesn't transfer it to the child if the child is negative. You see, a woman that has HIV may not be encouraged to breastfeed her child because it can pass through. So a woman may be told not to breastfeed so that the infection doesn't spread, because some of these things, the drugs you take, everything you take passes, the baby is fed from what you eat. That's why we say when a woman is pregnant, when a woman is breastfeeding, she shouldn't take alcohol. When a woman is breastfeeding, she shouldn't be taking she shouldn't take drugs, because these drugs can pass through the barrier and come through the breast milk and affect the baby. So these things happen. I hope that I have answered your question. This is 7 minutes past 8 o'clock, and this session is supposed to be for 30 minutes. This is our premiere session, but actually a test running session of our 30 minutes radio time. So by next week, you're not going to be seeing me in this way. You're going to be seeing me from the radio station, where we'll be live on radio, on YouTube, on Facebook, on Instagram, on different platforms, and it's going to be a call-in, and it's going to be engaging. So you will be seeing me, you'll be hearing what is being said on the radio, you'll be hearing the questions that people are asking. So if you have a question, please feel free to send it in. I'm going to answer it as best as I can. But I have said that for this program, I've put together a special combo for you, our esteemed listeners, where you can have a special package. And this package, let me explain to you briefly what this package is about. This package is supposed to be a code Fresh FM, but we are not on Fresh FM right now. So you are getting the bonus of it. Do I have questions? If I have a question, please let me know. I hope I'm still live. Okay. Please, can you people on live session confirm to me that you are still really seeing me? Can you confirm that you are really seeing me? Okay. The video is blank. I'm here. Oh, please don't log out. I'm very much here. I think it has to do with. Okay, so I was talking about the special combo for you that you are listening to me today from any platform. And this special combo is when you call any of the numbers, just tell them code at Dr. Rita Premier, code Premier of, well, this is the code anyway. This is a special promo. What is this promo about? You are going to get a free 25 minutes session with me, not free. So this combo is 70,000. And what does it cover? One 25-minute session. This 25-minute session with me, it's 25 or 30-minute session or 15-minute session. I think it's a 15-minute session. Yes, 15-minute session with me. 15-minute session that would have been worth 30,000, but you are getting it at a subsidized rate now. This 70,000 covers 15-minute session, covers 1 month treatment. So when we finish doing the consultation, you'll be given treatment. You see, 1 month treatment. Then you will get food list of what to eat and what not to eat. And then lastly, you will get, for those of you who are in Abeokuta here with me, you're going to get a 5 minutes therapy. But for those people who are online, who are not going to be able to join, instead of 5 minutes therapy, you are going to get a 20 minutes consultation session. Trust me, you don't want to miss this combo. This combo is 70,000. You have 1 month treatment for whatever it is that is the problem that you are dealing with. You get a list of what to eat. So when we do consultation, 20 minutes. If you are online, you have a 20 minutes consultation. If you are in Abeokuta, you have a 15 minutes consultation. Okay, thank you very much. Yes, okay. So you have a, if you are online, you have a 15 minutes, 20 minutes consultation. If you are on in Abeokuta, you get a 15 minutes consultation. You get a 1 month treatment. You get a list of what to eat and what not to eat, or you get a 5 minutes therapy. So you can call any of the numbers and book your session from tomorrow. This offer is valid for the next 1 week from between now and next week Tuesday, when I'll be coming live again. So any day during this week, please make a call, reach out to the number 0706171385, and or reach out to our website. But I mean, why do you want to go to website when you can just talk to us straight? So send us message, call us, and let us know. Then if you have a question you want me to talk about, hey, why don't you send me your question? Why don't you send me your question? But in the absence of any other question, because I'm planning how to keep to 30 minutes time, which is already 11 minutes past 30 minutes, so that when I'm on radio, I will not exceed my time on air. I'm going to wrap it up now. I believe you have learned some things today. I look forward to seeing you next week. And this is a weekly program by the grace of God. We will be live every Tuesday. This is the first one. I know I've not been online for a very long time. I'm back now, and now I'm more structured, I'm more organized. So you will see me every Tuesday by the special grace of God, if rapture did not take place. I'll be here next week Tuesday, 7:30 to 8 p.m. Thank you for logging in. Please subscribe to this channel, turn on notification, and you'll be glad you did. I'll see you next week Tuesday. Bye. Thank you so much.